Hello, Dr. Zheng. Uh, I have kind of an interesting story to tell your viewers, and you can comment on it. I have a friend, let's say his name is Roy, that's not really his name, but him and his wife was on a vacation and they ended up going to Corey, Pennsylvania, and visiting family. And while they were there, Roy has developed a temperature, and a very high temperature, like 102, 103. And he went to see a doctor in a small local town, and they gave him some antibiotics. Now, Roy had had a knee replacement about 4 years prior to that. So he still maintained a low level of temperature, maybe 99, maybe 100. So when he got back to his home, he went to see his orthopedic surgeon, and the orthopedic surgeon said that that infection had gone to his knee. So he was very upset that the doctor that he saw didn't realize that and send him to an infectious doctor that would have given him a lot of antibiotics to prevent that from happening. But anyhow, that surgeon had to remove the knee replacement. Roy spent about 8 weeks in a nursing home with no function in his leg at all. There was nothing connecting the lower part or the upper part. And they had to take the knee replacement out. They had to treat the infection until they were sure that there was no infection in his body or in his knee, and then they put a new knee prosthesis back in. And then he had to recover from that surgery, which again took a few months, before he was feeling 100%. He's fine now, but that's something that anyone that has had joint replacements anywhere in their body and starts to run a temperature, they should make their doctors aware of that.
Yeah, I think that's a very informative story because when you have an artificial part in the body, then it's a foreign material. It tends to cause either inflammation or infection. And we're talking about hot weather, and when your core body temperature increase or you eat a lot of spicy food, the internal heat can cause inflammation, and higher temperature will encourage the bacteria to grow. Like for instance, on the skin, there are bacteria, but when our immune system can control that bacteria um, under certain circumstances. But once your immune system is weaker, or by taking cortisone or immune suppression, and also when the bacteria overgrowing and they release a lot of toxin to the body, and that can suppress your immune system. And under that condition, your infection will explode, and the immune system cannot handle that. And that's how the antibiotics needed, because only you kill the bacteria to a certain level, then your immune system can handle that. So just like you said, if you have fever and in the meantime you also have an artificial joint, then you really have to watch that. Even the temperature is not high enough, like your friend, he took antibiotics for a few days. The temperature is not as high as before, but it's still the infection continues and causing this knee replacement the second time, right?
Right.
Thank you.